Hi, I'm Dr. Musenze, and today I am going to talk about weight loss management and the GLP1s and the GIPs. These are not new drugs. We have new formulations, but some of them have been there for quite some time. Just give you some basics. GLP1 means glucagon-like peptide. In other words, it's just like glucagon, but not quite. The role of GLP1s are to, one, increase insulin secretion. In other words, they stimulate more insulin production in your body. They also decrease stomach emptying. So in other words, food takes a while to get out of your system. Digestion is significantly slowed. Then we have the GIPs, and the GIP is the glucose-dependent insulinotropic peptide. And these ones, one, increase insulin sensitivity. Remember, the GLP-1s increase insulin secretion, but the GIPs increase insulin sensitivity. In other words, your body cells can easily respond to the insulin that's already been manufactured. The GIP-1s also decrease stomach acid secretion. So in other words, if you have less stomach acid in the stomach, digestion is slowed, which means digestion takes longer, which means you are full quicker instead of absorbing so much food at the same time. Now, the topic of this presentation is the tide wave. All these drugs are tide drugs. We have semaglutide, we have tirzepatide, we have dulaglutide, we have liraglutide, and then we have a new one that I'm going to talk about. It's not even out yet as of November 2023. So just to go back and break these drugs into their different respective individual classes. Semaglutide has three big classes. They have the Rybelsus. Rybelsus has not been approved for weight management. Right now, it's a type 2 diabetes medication. Because of that, I'm not going to say anything else about that. Just know it is in the semaglutide group, but it's only for type 2 diabetes. The next one is Ozempic. Ozempic was previously a type 2 diabetes medication only. The FDA, the Food and Drug Administration, has not yet given the green light to use Ozempic as a weight loss medication. However, it can be used as an off-label medication for weight loss. Now, the key about Ozempic is it's a weekly dosing. Just to say something about Rybelsus, it's a daily dosing. When you come to Ozempic, one time, once a week. That's all you need. You go down to the next one, Wegovy. Wegovy is the hot topic right now, along with a few I'm going to talk about. It is now approved as of June 2021. The FDA approved use of Wegovy for weight management. Wegovy is also a once weekly formulation. So in other words, use it once a week. It has beautiful results. So those three make up the semaglutide. Before we get off of the semaglutide, I want to just mention that semaglutide is made by Novo Nordisk. It matters who makes these drugs because the pricing will be different and how they're advertised is different. So just keep a mental note that semaglutide and all the drugs within is made by Novo Nordisk. The next class are the tirzepatides. Now, tirzepatide, this is a little bit different from the semaglutide because semaglutide is a GLP1, whereas tirzepatide is both a GLP1 and a GIP1. So you have the double effect of increasing insulin secretion, decreasing stomach emptying. You also have increasing insulin sensitivity, and you have decreased stomach acid secretion. So you have that tandem effect of those four things because tirzepatide has both hormones in it. Now, if you break tirzepatide into its respective groups, you have Mounjaro. Now, Mounjaro is approved for treatment of type 2 diabetes. Mounjaro is a weekly dosing. Another one in that group is Zepbound. Zepbound is a brand new kid on the block. As of November 2023, this month right now that we're recording this video is when Zepbound was approved for weight loss. Some of the studies show that participants or people who take Zepbound lose as much as 52 pounds. That's about 1/4 of the person's weight. New kid on the block, super potent, looking really promising for weight management. The key with the tirzepatides, it's made by Eli Lilly. Remember, we have Novo Nordisk. The tirzepatides are made by Eli Lilly. Going down the list, we have dulaglutide. Dulaglutide is Trulicity. It's always on TV as well. Trulicity, right now, we only use it for type 2 diabetes mellitus. The FDA has not approved it for weight management. The dulaglutide, aka Trulicity, is also a once weekly formulation. You don't have to take it every day, just take it once a week. Next up in our category, we have liraglutide. Again, the liraglutide is the common denomination in this. That one is broken back into two. We have the Victoza. Victoza is approved for treatment of type 2 diabetes mellitus. Right below that, we have Saxenda. Now, Saxenda is also a new kid on the block and is being used for weight management. Both Victoza and Saxenda are daily formulations. So that's a little bit of a difference between when you use Wegovy or Ozempic or Zepbound, where it's once a weekly formulation. Saxenda is a once daily formulation, so you have to take it every day. Now, going on to the future, we have a brand new kid on the block. It's not out yet, so brand new kid in the pipeline. It is called retatrutide. So retatrutide is the common denomination. The retatrutide will be a hormone receptor agonist, just like these are all agonists. In other words, they turn on the hormone. Antagonist turns off, agonist turns on. So they act like the hormone. So retatrutide is a hormone receptor agonist. It will be a game changer because, just to kind of recap, the semaglutide group targets just the GLP. The tirzepatide targets GLP and GIP. When you come down to retatrutide, it will target 3 different things. It will target the GLP that we've seen, the GIP that we have seen, and then it also targets glucagon. Now, going back to your biochemistry, glucagon is one of those enzymes that comes in to tell the body to make more sugar. In other words, if you've been fasting for a while, it comes in and tells the body that you need more glucose, so it tells the liver to go break down glycogen so you can make more glucose. I will release another video more on the pathophysiology, on everything that retatrutide is going to be making, how it's going to be acting in the body, what weight loss goals we expect, but I really think this is going to be a new kid on the block and it's really exciting. Now, of course, just like everything, we cannot talk about medications and not discuss the side effects. These drugs have been proven potent. They're amazing. Not cheap right now, but they're great for weight management, especially if you've been struggling with weight for quite some time. One of the things that we have had to deal with as physicians, Number one thing are GI symptoms. So because they slow down emptying, you're going to get GI symptoms. Some of the things that anesthesiologists have been telling us, for instance, before a patient has surgery, they have to be NPO. In other words, they can't eat anything by mouth. However, they have realized that even if a patient has been NPO after midnight the day before the surgery, when they go into the OR, they still find that they have food in their stomach. And because of that, it increases their risk of aspiration. So, what the recommendations right now are, if you take any of these medications, let's say you take a once a week formulation, you take it once every week. Before you have any surgical procedure, you stop the drug for 1 full week, because that's pretty much when you expect to take it again. However, if you take the drug on a daily formulation, such as the one we talked about that you take on a daily formulation, like Saxenda, then you want to stop the drug the day before. Don't stop it a week before, because you don't take it once a week, you take it every day. So stop it the day before. That is going to decrease the risk of you having food stuck in your stomach the day before your procedure, and it's going to decrease the risk of aspiration during the procedure. So that's the key thing that you see. A lot of these things have been kind of looked at as GI symptoms. One of the things that's being looked at right now, not being studied in humans, but it's been studied in mice, is any one of these drugs can increase the risk of medullary thyroid cancer. So if anyone has a personal history or a family history of medullary thyroid cancer, these drugs are currently a contraindication. So this is a quick summary of the new kids on the block, the old kids on the block, the things in the future. I'm talking about the hormones they target, the drugs, who makes these drugs, and the side effects we have to watch out for. These are very, very promising medications for anyone who's having problems losing weight. On top of course, if you have diabetes, you don't have to have diabetes to use these drugs, but if you do have diabetes and you have a problem with weight management, these drugs can be very, very efficacious. Don't forget to like and subscribe and follow me for future videos. Cheers.